Hi, I'm Renali, and I was diagnosed with stage 3 colorectal cancer at 26 years old.
The moment I knew that I wanted to marry Renali was the first time I met her family in India. I'm like, she's the one.
Mm-hmm.
Yeah, I remember the moment very, very clearly. We had just moved to New Hampshire. A week later, we had an engagement. It was happy days. A month later, she was diagnosed with cancer. We went from being really excited to get married and to, plan the rest of our life together to this really big event that changed everything.
Before my diagnosis, life was like it should be for a 20-something-year-old. I was just doing my job, saving for my wedding with Chris, to travel, to do the things that we like to do. I traveled back home to India to see my family. I didn't, on the exterior, appear to be someone who was sick. I started having some very baseline symptoms, so some like stomach issues, some constipation. I had seen a doctor and I was prescribed some stronger laxatives, some stronger pain relief medication, some other medication that helps with your digestive issues. It did help until it stopped working. We went back to the doctors. Within 2 days, they did a CAT scan and they found that there was a tumor in my body. And then we turned around and we landed in New York, and my uncle, Vicky, took me to the ER. The doctor finally came in. He said, it looks like it's cancer. I was connected with Dr. Hornstein and I was in my hospital bed, and he gave me a call and he said I had an unresectable tumor.
My name is Nicholas Hornstein. I originally heard about Renali when I was, virtually tuned in to a tumor board. Renali's cancer was extremely serious. When I first heard about her, she had been hospitalized for days. She had been having daily fevers for weeks. She was losing the ability to walk. And remember, this is a 26-year-old. This is somebody that should be in the prime of their life. One of the key features that we look for in patients with colorectal cancer is the presence or absence of something called microsatellite instability. These are a series of proteins that basically mean your tumor isn't able to proofread its own DNA. Her microsatellite high tumor was the key thing that really drove our thinking and our decision making to say, well, surgery doesn't make sense here. Chemotherapy doesn't make sense here. We need to look for, this other option.
I was prone to getting colon cancer in my lifetime because we have a very strong history of cancer in the family. I just didn't think it would happen at 26.
Renali was a candidate for Opdivo plus Yervoy.
Opdivo, nivolumab, is a prescription medicine that may be used in combination with Yervoy, ipilimumab, to treat adults and children 12 years of age and older with a type of colon or rectal cancer, colorectal cancer, that cannot be removed with surgery or has spread and is microsatellite instability high, MSI high, or mismatch repair deficient, dMMR. Opdivo and Yervoy can cause your immune system to harm healthy parts of your body during and after treatment. These problems can be severe and lead to death. See your doctor right away if you have a cough, chest pain, shortness of breath, irregular heartbeat, diarrhea, constipation, severe stomach pain, severe nausea or vomiting, dizziness, fainting, eye problems, extreme tiredness, changes in appetite, thirst, or urine, rash, itching, confusion, memory problems, muscle pain or weakness, joint pain, flushing, or fever. Report severe or persistent muscle or joint pain. Tell your doctor if you have myasthenia gravis or Guillain-Barré syndrome. Immune system problems include Crohn's disease, ulcerative colitis, or lupus. These are not all the possible side effects. Problems can occur together and more often when Opdivo is used with Yervoy. Tell your doctor about all medical conditions, including immune or nervous system problems, if you've had or plan to have an organ or stem cell transplant or received chest radiation. Opdivo plus Yervoy can harm your unborn baby.
After my first dose of immunotherapy with Opdivo and Yervoy, I started seeing some noticeable changes and improvement in my symptoms. I was gradually able to build up my appetite and walk around more, do some activities with more independence. I'm very grateful to my family for just taking care of me and giving me support every single day and telling me that I would make it through this.
It was really important for me to create sort of a sense of normalcy for her because, it was such a shock. And it was such a dark place that you just get thrown into unexpectedly. It really helped planning and also imagining our wedding, looking towards the future and really trying to paint a positive and beautiful future. Really was something we did a lot.
I'm really lucky to have a great relationship with Renali. I think that all patients are on a different journey and there's no wrong way to be a patient. So whenever there's an opportunity for my patients to engage more, learn more, I always try to push them towards that.
I think beyond just having a professional relationship with my oncologist and going through treatment options with him, it was important to have a more personable relationship. He really helped me stay positive. Invited himself to the wedding, so I guess he's coming.
Yeah, he's the guest of honor for at least one of the nights.
I think my hope is to be able to remain healthy, number one. And I try to live in the moment, and I want to have a grander wedding than I was planning on having. And I just want to keep excelling in my career.
I think this experience has taught us, or at least shown us, how precious life is. I've certainly taken inspiration from her strength of living in the moment and, taking everything, being present.
Dr. Hornstein called me up and he said that there was no evidence of disease in my body. It felt like I won that day.